Hello participants. In this presentation, I would like to take you through the CUF process, which describes responsive feedback in 5 simple steps. The CUF process consists of 5 key steps that you will need to take to enable you proactively learn through responsive feedback. Based on the acronym CUF, these steps are as shown in the process chart. C stands for convince stakeholders, U, uncover assumptions, R, reveal learning opportunities, V, seek evidence, and E, evolve. Now we will go through each step of the CUP process, and the first step is convince stakeholders. Ongoing learning and adaptation is a team sport, bringing varied stakeholders who work together cooperatively to make learning happen. You will therefore need to convince stakeholders who buy into the value of feedback and learning and are ready to work together to gather, analyze, and act on feedback. Such stakeholders may include senior leaders such as directors in Federal Ministry of Health or National Primary Healthcare Development Agency, executive secretaries in the state primary healthcare boards. You also need to include donors who provide the resources and program designers who are involved in the initial concept and design of the program. You will need to involve also the implementers and M&E specialists or persons experienced in data management. Community gatekeepers are as well very important, and such may include traditional and religious leaders. You also need to gain consensus for regularly gathering and acting on feedback and plan how you will work together. You will need to create streamlined decision-making processes for acting on feedback, which is very important. Therefore, to help you get started, you need to answer these questions. 1. Who needs to be involved in defining what you want to learn, in gathering data, and in the approach to the changes in your program? Who would you also need to involve in decision about various aspects of the program and what evidence may be required? In convening stakeholders, it's important that you consider these ingredients of success. If they are not in place, you could do anything to bring them about. Ask yourself, is there a trusted relationship with funders or other major stakeholders such that frank discussion is possible? Most often, we find it difficult to discuss changes in our programs or projects, especially with donors. The theory of change is often seen as being cast in stone. Is realizing a need to change seen as progress, not failure? Many times, changes are seen to be arising as a result of failure. You also need to ask whether organizational inertia or rigidity make change difficult. Organizations have established norms and values that have been built over time, and that sometimes make learning and changes very difficult. Does your leadership support your learning approach? Again, organizational learning culture is critical to learning and responsive feedback. You also need to ask if there's willingness to delegate decision-making authority closer to the front lines where possible. And that could be bringing, for instance, some of the decisions from the State Primary Healthcare Development Agency or board to the local government council. At the end of this step, you should have a stakeholder engagement plan with both internal and external stakeholders' roles and responsibilities clearly defined. You will also have a decision-making process. Having convened your stakeholders, the next step you need to take is to uncover your assumptions. Remember, an openness to learning begins with humility. We may not have perfect knowledge. There may be more to learn, or there may be a better way. In this step, you will need to seek areas where you may have something to learn. Examine your beliefs about how you think your program works, looking for assumptions and areas where you could benefit from learning more. And in doing that, you first need to answer the following questions. 1. What is the causal chain through which your program achieves the desired result? 2. How do you know that's true? And 3. What assumptions have you uncovered? It's also critical that you consider the following ingredients of success. Asking yourself whether there is willingness to challenge accepted wisdom. Do all staff feel comfortable making suggestions or questioning the way things are done? Or do senior leaders actively encourage learning and innovation? At the end of step 2, you will have your theory of change and assumptions clearly defined. Having uncovered your assumptions, the next step that you need to take is to reveal your learning opportunities. For you to get good answers, you need to ask good questions. And now that you have identified broad areas to investigate, you need to proceed to write specific learning questions. We often don't investigate our assumptions that has been built in the initial theory of change. And we wait until the end of the program or project implementation and we begin to ask questions. For example, imagine a nutrition program that has been implemented with the assumptions that providing counseling to pregnant and lactating mothers in the health facility will enable them to practice appropriate infant and young child feeding practices in their homes. This project has failed to identify key influencers, especially in the community, who determine whether the baby will be exclusively breastfed or not, such as the grandmothers or mother-in-laws, or those who even determine when breastfeeding should be initiated. This example brings forth the importance of having constantly checking and investigating your assumptions. For you to have an effective investigation into your assumptions, you need to answer the following questions. How can you write learning questions that will enable you to investigate your assumptions? Here you listen and learn questions such as, is it true that? Why? You need to test and learn questions such as, how can we? What if? For instance, is it true that if we provide information to pregnant women on antenatals, they will be able to complete their antenatal visits? Or why are children under 5 not brought to the immunization clinic when we have provided all the trainings that are needed by healthcare workers and we have provided the vaccines? Or what if we provide skill acquisition interventions to mothers to help them adopt positive health behaviors? You also need to ask yourself whether you have got input or consensus from a wide range of stakeholders. And finally, you ask whether you can prioritize your learning questions by, for instance, importance, impact, or ease of answering the learning questions. For you to effectively reveal your learning opportunities, you need to consider this as ingredients of success. And if they are not in place, you could do anything to bring them about. First, ask yourself, is there openness to experimentation and new approaches? Organizations are often not comfortable moving out of their comfort zones and adopting new ways of working. You also ask, are useful ideas actively sought from other organizations or even outside the sector? Many times, other organizations may be doing the same thing that we are doing and have had lessons that have been learned over time that you may need to leverage from. Or you have, for instance, a childhood nutrition program that treats severe acute malnutrition in the health facility. That kind of program will not address all the wide determinants of malnutrition and will therefore need to link up with, for instance, the agricultural sector. You also ask, is it an organizational priority to pause and reflect on learning opportunities and ways to improve? That's critical, and organizations really need to establish that culture. At the end of this step, you should have your learning questions agreed and prioritized. Now, having gone this far, the next step for you to take is to seek evidence. And now that you have clear questions, it's time to find the answers. This is your opportunity to find feedback and evidence that teach you something new. For you to do that, you first answer this question. How can you find evidence to answer your questions and meet stakeholders' needs? It's also important that you consider this as ingredients of success while doing that. Always think of bringing these ingredients if you don't have them in place. Ask yourself, are people willing to give frank and honest feedback? Are there issues with data falsification or quality? It's a big issue in our health system in Nigeria at all levels, despite all the efforts that have been put in place. Therefore, it's a very important ingredient. Do you have the skills to innovate and generate new ideas for testing? Capacity building is an ongoing and cross-cutting strategy that always should be embedded in responsive feedback. Do you have the expertise to run the experiments or collect data? Also very critical. If they are not in place, how can you get these ingredients? At the end of this step, you should have your research plan agreed and implemented. The final step is for you to evolve. Here you benefit from all your hard work to learn. Now take time to pause and reflect on what the evidence is telling you, and most importantly, act on it. Use what you have learned to make your programs better. You will need to ask yourself, what is the evidence telling us? What decisions should you make as a result? Are these appropriate within your current situation, considering stakeholder preferences, costs, and urgency? How will you monitor whether this is working and repeat the cycle? Here you think of your policy briefs, facts, and other information dissemination methods for you to reach out to especially the high-level stakeholders. It's critical that you consider these ingredients of success, and if they are not in place, try to bring them about. Is there a willingness to listen to evidence even if the implications are uncomfortable? That's a big question. Many times, especially political office holders, shy away from especially negative results. You also ask, is there a willingness to implement change? If it's not there, you need to advocate for that. Are there opportunities in place to share your lessons across your organizations and partners? Very important. We often times or sometimes hoard information for fear of competition. It's essential that we disseminate our lessons for maximum impact. At the end of this step, you should have distilled lessons and action plan. This is the end of my presentation. I thank you very much for your attention.